People with OCD don't necessarily need to participate in like ritualistic activity, like washing their hands all the time or counting or whatever it is, for them to have OCD. A lot of times, people with OCD have pure obsessional OCD, where they obsess and ruminate and they do mental sorts of rituals. And just to be clear, the obsessions are not emotionally neutral things. They're typically very shameful or taboo or aggressive or violent or sexually deviant thoughts that are intrusive and uncomfortable and do not align with the person who is experiencing them. With that being said, there are a plethora of uncomfortable feelings or thoughts that you can have, but I have found a trend among which obsessions target which people. And this is not literature or anything, this is just my anecdotal experience of treating patients. The obsessions that people tend to have are usually the thing that is least aligned with who they are as people. Let me explain what that means. For example, there is like violent, intrusive OCD. And they tend to notice that the intrusive thought pops up the most when they're around the person or people that they can never even imagine being violent or hurting. And by the way, the thoughts themselves are irrational, they're not based in any sort of reality or evidence, and the patient experiencing it knows that. But what they feel is a huge sense of shame that they are even having this thought. They often feel like, what is wrong with me? Like, how could I even think about being violent towards my loved one? So typically when I meet people with OCD, I tell them, the fact that you have this kind of obsession tells me what kind of person you really are. If you are having an obsession or a intrusive, uncomfortable thought about violence, that must mean you are at your core an anti-violent person. And I like to tell them that to give them just a small sense of relief because it's true and it is something I've noticed. If you're struggling with thoughts like that, you can at least be rest assured that the reason why those thoughts make you so uncomfortable is because that is exactly who you aren't. And if you struggle with OCD, definitely get into treatment.